Hello, and welcome to the Heroes for Oral Health podcast, a podcast series about the different heroes in oral health that interact with us and that are making a difference in the lives of others. Thank you both for joining me. Wouldn't mind just giving a brief introduction?
I'm Tammy Davis. I'm a licensed dental hygienist, and I know Dr. Angie because we worked together at a previous not-for-profit organization where she was the first dentist that we hired in from a new startup from that aspect.
And I am Amy Hazelwood. I'm also a licensed dental hygienist. I've been in practice for about 40 years. I taught for about 30 years part-time at the local dental hygiene program. And I'm part of this project because Dr. Angie was my daughter. She was a dentist, and we actually work together in private practice as well. And we are the co-founders of the Dr. Angie's Dental Health Exchange.
Can you give a brief description of the project?
Yeah, so Dr. Angie's Dental Health Exchange, we're a not-for-profit program, and we help coordinate the access of dental care for underserved populations. So we link them with dental professionals that help our patients, and then our patients actually earn this treatment by completing community service.
How did the idea for this project form?
You know, Amy and Dr. Angie and I were at a continuing education program one evening together, and a group from Battle Creek, Michigan was presenting about their program. It's a program that we've modeled after, and we were really interested in and excited about what they were saying and how they were helping their community. And Dr. Angie had leaned over to me and said, "Hey, we need to get something started like this in our area." And she was so for helping underserved people. And she said, "You start it and I'll help you." So that's kind of where the idea was born. We were just so excited about what we saw in another community and how it impacts our community. And it took a little bit of time to kind of get going, but we took a couple of years to kind of get going with it. But ultimately, it just was something that never would leave me, kind of kept gnawing at me in the back of my brain, like that we needed to do this. So we finally decided to move forward. I think part of it was Dr. Angie had such a heart for helping people, and she ended up getting non-Hodgkin's lymphoma and passed away. When that happened, it just really makes you kind of reevaluate things in general in your life. And it just made us want to do something even more to help people, but also do it in her honor as well.
Yeah, and there's no doubt that the need existed for this. People going to the emergency department for dental pain or infection had increased by 10 times over the last decade. And the adults that are of low income or unemployed really don't have a lot of options. Children often have benefits in dentistry through Medicaid, or maybe handicapped adults or disabled adults also get some Medicaid benefit. But we found that these people just really had nowhere to go. And so that was the catalyst for the initiation of this program as well.
How has it grown from the start and that both of you are fulfilling this need to where it is now?
Well, the way it started, Tammy, I'm going to let you talk about more the business aspect of it, because she seemed to have the background, which was important in getting this flying off the ground.
Yeah, so at the beginning, it was just an idea, and both Amy and I were passionate about that, but we hadn't done anything like this before. So fortunately, we were able, to brainstorm, and we had really great people that were able to come around us to help us form a board. So we had to, form our board, tame the nonprofit status, kind of keep things moving forward. Then we had to look into applying for grants, and thank you for the Dental Trade Alliance for helping tremendously with that. So we took all of that, and it's a huge undertaking, and we had to go through, how are patients going to come to us? How are we going to market, get patients to us? How are we going to secure their records? How are we going to train them? So the whole organization of the program itself and how it was going to be set up had to be organized and then implemented. And then also we had to partner with dentists and get dentists, on board to help us, which they were more than happy. We have several dentists, and Amy can kind of talk about how many in our program now, but we have several dentists that were volunteer dentists, as well as the local education program. So at the beginning, it just took a lot of back-end work to create the business aspect of it, and then organize the programs, how we want to make them flow, and how we to implement those into community. Just kind of grew from there. So once we got the foundation built, we were supported that foundation, we're able to go out into the community and start to offer our services. I also spent some time on an emergency committee. I was a committee member on it with an emergency department of our local hospital too, just to kind of give them some insight of what we're doing, and for me to get insight of how we can help keep those patients out of the emergency room. So we did a lot of things in the community as well to make sure that people knew who we were, but also for us to learn all the needs that need to be really met in how we could help fill that gap as well.
Yeah, Tammy definitely was the business mind to this. I wanted to just throw patients in the chair and start treating them, but we found out there was a lot more to that. We had to, in fact, buy insurance for our board. We had to choose these awesome board members, and Tammy had a big hand in that. We actually have a couple of dentists, an attorney. We have a marketing person, an emergency department doctor is on our board, a hygienist, or actually there were 3 hygienists in the beginning, and we have 1 dental assistant. One of the hygienists was director of the dental hygiene program at the IU and university in our area. And so they were very important in helping us establish this program and help support us. And then we were able, not right away to see patients, but it probably took us almost 2 years to really start to see patients. And we got dental software donated by a business, so we were able to secure patients' records online. We knew it was important not to be shuttling records around from dentist to dentist. So our local dentists that volunteer, and we have about 40 on board right now, and they all share the treatment of patients. So it's not a big burden to any one dentist, and they can access patient records through a secure website, and they help us as much or as little as they can. We know the dentists that are willing and able to do extractions, and the ones who are more willing to do treatment planning and the diagnosing, and then the others that will do restoration. We have both dental hygiene programs in our community are on board, and they do many of the radiographs, and they've agreed to do preventive care. And to continue that, once someone's in our program, they can go through the school and indefinitely get care. And there's never any money exchange. There is always just community service that is the payment for the care that is then donated by these local dentists in the convenience and comfort of their own offices. And that's another plus to our program. The patients don't feel like they're a charity case. They've earned the care, and they mingle in right with all the other patients in the office and don't stand out as someone unusual or somebody that is, in need of care that can't pay for it.
That's fantastic. And it sounds like had the patients and did all that work to get a great program up and running. And so going forward, what are your goals now?
Well, we operate strictly through a cell phone and a laptop. We have 1 paid employee, and she's the one that makes sure the patients are qualified. They have to be an adult, they have to be 18, they have to not have any dental coverage, including Medicaid. Their income level has to show that they are in need of care. And so she does all of this through her home, and then she meets patients where it's convenient for them. And part of her job is to educate them. And really our biggest goal is to keep people out of emergency departments and get them on a road to good oral health so that they can maintain a healthy mouth. It helps them not only feel good about themselves, it makes them healthier because we know that the oral health can affect the whole body health. So that's a good goal. And we want to just have them practice good oral hygiene, good maintenance of their oral health. So again, they keep out of emergency departments, and hopefully the more people that learn about our program will come to us before they get to a crisis situation and keep the emergency rooms free for true medical emergencies. You would ask what some of my favorite parts or our favorite parts about this program are, and if you could see some of the letters that patients write to us saying how we may have even saved their lives, that just makes us feel really good. A couple of our participants have actually found employment while they're on their volunteer route, and we think that's an awesome thing. Hope that the information they learn from us passes down to other people in their family that may be in the same situation, that they can come to us and get this care again before it becomes a crisis situation. At their enrollment, we're able to give them some education. Our coordinator not only explains the rules of the program, but we've developed a short video that hits on all the important topics for adult good oral care and good oral health, and these also are available on YouTube. We also give them an oral health kit, which includes a toothbrush, some toothpaste, and some rinse and floss so that they have proper tools to get started on good oral health too.
What are you both most proud of?
I would say I'm most proud of the impact that it makes on people's lives and the community. It's just such a win-win program, and that's what I was so attracted to it from the beginning. And, the patients get help that then they go and they serve community centers or community nonprofit organizations. They get help. And it's just a ripple effect of positivity through the community as well. So I'm very proud too that it's still going strong. So the dedication of our team, our volunteers, has been amazing to keep it going through as long as it has so far and continue the growth. And this is such an amazing time to be able to grow considering our current environment right now. The need to keep people out of the ER so we can help this health crisis is so important. And Dr. Angie's really can help with that.
Yeah, and I guess I'm proud of the fact that we were able as professionals to step outside of what we do every day and make an impact on people's lives as well. So far, we've been able to provide about $125,000 in value of treatment to patients that were unable to pay for that, and donated well over 300 treatments. And we've had many calls and we're able to enroll. We're getting close to 200 patients now. We recently had our local newspaper put in a couple of really awesome articles explaining the program, because that's been one of our goals, to get people to be aware of it. We've dropped off flyers and posters we've had made to about any place in our community that people of low income would frequent. So they're able to, again, refer people to us before it becomes a crisis situation and people end up in emergency departments where, as you probably know, they really don't get their problem solved. They either get an antibiotic or maybe some pain medication to temporarily relieve the problem, but it's never going to go away until a dentist is able to treat the teeth that are problematic.
Thank you both for this wonderful program and all that you do.
Thanks, Sarah. Just thank you for your support and your organizational support. That's helped us tremendously as well. So thank you for helping us get our message out there, continue to share our program. We appreciate it.
Thank you very much, Sarah. And thank you to the Dental Trade Alliance Foundation. They really helped us get the booster we needed to get this program off the ground.
Thank you, and I hope you both stay safe. Again, I thank you very much to both of you for your time and for all that you do.